Hello and welcome. It's Nurse Eunice with Florida Training Academy, and today we're going to be covering the topic infection control and prevention for certified nursing assistants. And so we will get started in a few moments. Welcome, everybody. Let's get started in 10 seconds. All right, so number one, you will use standard precautions in situations where you are A, bathing a resident with a raised red brush, C, cleansing a set of dentures, B, cleaning a set of dentures, C, removing used linens from a resident's bed, or D, all of the above. When would you use standard precautions? Revealing the answer in three, two, and close. It's going to be D. It's all of the above. So let's go back and look at those tasks. You have to use standard precautions when you're bathing someone, when you're cleaning dentures, and when you're removing used linen. So the correct response is D, all of the above. Any task during which you may have contact with open areas of skin, blood, or bodily fluid or mucus requires standard precautions, which includes hand washing and the use of personal protective equipment such as gloves. So I do see some correct answers. Number two, and if we have any nurses or licensed CNAs who are tuning in, happy Nurses Week. Number two, patients who are being ruled out for or have tests should be placed on what type of precautions? A, airborne, B, protective, C, COVID, or D, enhanced? All right, I see the correct answers. All right, we're going to reveal the answer in three, two, and one. If you chose A, you are correct. So, whenever we have a patient who has tuberculosis, we have to remember that those droplets are spread in the air and they're going to be placed on airborne precautions. All right, and so your facilities will also usually fit test you so that you can be fitted for the specialized N95 mask. And also patients with tuberculosis also usually put in negative pressure rooms. Number three, which of the following symptoms is an early infection in patients? So an early sign of infection. Is it A, fatigue, B, nausea, C, muscle aches, or D, sudden chills? An early sign of infection. All right, revealing the answer in three, two, and let's see who had the answer correct first. So I'm going back, and looks like the first person with the correct answer was Wesley Sniper. So, Wesley Sniper, yes, sudden chills would be the correct response. And the rationale is sudden chills or rigors are often an early sign of infection, indicating the body's initial response to pathogens. Fatigue, nausea, and muscle aches may develop later as the infection progresses. Let's go to the next one, team. Number four, as you are changing the linens on your patient's bed, you accidentally get stuck with a needle that was left in the patient's bed. You must blank. A, report it to the nurse. B, quickly wash your hands with lots of soap and water. C, report the needle stick injury the following day. Or D, both A and B. All right, Tanya, Letitia, I see some correct answers, Corral, and I hope I'm pronouncing your name correctly. If you chose D as in dog, you have the correct response. You have to wash your hands immediately. So you press the button to get that nurse into the room because exposed needles are considered contaminated. And when you accidentally stick yourself, wash your hands with soap and water, get to the nurse, and they're going to take you to employee health so that you can get additional testing. And if you have to have prophylactic medication to prevent HIV or any other infections, your nurse and your hospital team will help you accomplish that. Number 5, the single most important thing that all healthcare workers can do in order to prevent the spread of infection is A, following standard precautions, B, proper hand washing, C, using gloves, or D, isolating patients. This is an easy one. Let's see who gets it first. Tanya, you got it. And so, everybody, for this one, the correct response is going to be proper hand washing. And here's the explanation. I'm trying to hide this. There we go. Proper hand washing is the single most important thing that you can do in order to prevent the spread of infection. Standard precautions, the use of gloves when needed and isolation when needed also prevent the spread of infection, but hand washing is the single most important thing that you can do to prevent the spread of germs. Number 6, the most important part of the hand washing procedure is A, using the hottest water you can tolerate, B, using only antibacterial soap, C, using adequate friction, or D, taking a full 3 minutes to wash your hands. If you choose D, you won't have any skin left on your hands. So D is not the correct response. And looks like Anna has the correct response. Yes, Anna. Anna, it is. If my computer will move today, C, using adequate friction. So, rubbing hands together during routine hand washing is the most effective way to prevent the microbes or germs. The water temperature should be warm, but not at the hottest setting. And you may not have antibacterial soap. So if you have soap, period, and you're using it properly and using friction, that's going to help reduce the spread of germs. And then lastly, you don't wash your hands for 3 minutes. You wash your hands for 15 to 20 seconds, depending on your state requirements. Number 7, which of the following cannot be treated with an antibiotic? So that means that one of these is not a bacterial infection. Which one is it? Is it A, syphilis, B, gonorrhea, C, shingles, or D, MRSA, also referred to as MRSA? Which of the following cannot be treated with antibiotics? I see one correct answer so far. I see one. Anna, you did it again. The correct response is C, shingles. So everything else was caused by a bacteria infection, a bacterial infection, but shingles is caused by a virus. It's the same virus that causes chickenpox. And so that cannot be treated with an antibiotic. That will be treated with an antiviral instead. Number 8, Mr. Delaney has a norovirus infection. Which of the following interventions is not effective against norovirus infections? A, hand washing, B, alcohol-based hand sanitizer, C, contact precautions, or D, bag soiled linen at the bedside. If you don't know what the norovirus is, think of when people get diarrhea and nausea after being on a cruise ship. That's the norovirus usually. So which one is not effective against that type of virus? Virus is the key word. Okay, Anna, you're really good with this one. Anna, it is alcohol-based sanitizers. So the norovirus is a very contagious virus that causes vomiting and diarrhea. It is resistant to alcohol-based disinfectants. So not every germ or bug can be killed with hand sanitizer, which is why you're always going to hear when we're talking about infection control that we need you to use soap, water, and friction. That's how you remove those germs, specifically if it's something that a hand sanitizer can't kill. So contact precautions are also indicated, and following facility procedures is essential to halt the spread of this very contagious virus. And one of those things was we're, bagging their used or their sold linen separately. Make sure if you can use hand sanitizer, your facilities will usually let you know. But when in doubt, always wash your hands upon entering the room and as you exit the room. And that's going to help prevent the spread of germs. Number 9, you must wear gloves when you are blank. A, preparing infant formula for a newborn baby. B, transferring breast milk into a baby bottle. C, knocking on a patient's door. Or D, opening a patient's door. Which is the most contaminating? Which do you have to wear gloves for? Looks like Brianna has it. Brianna, Anna, those are two separate names, by the way. Yes, you're going to wear gloves whenever you're transferring breast milk because breast milk is considered a bodily fluid. So you must wear gloves. It's not necessary to wear gloves when you're preparing the infant formula because, again, the formula, the powder isn't a bodily fluid. And lastly, you do not have to wear gloves when you knock on or open a patient's door. Number 10, what is the purpose of personal protective equipment, also called PPE? Is it A, to protect the patient from the spread of diseases? B, to protect both the healthcare provider and the patient from the spread of diseases? C, to protect the healthcare provider from the spread of diseases? Or D, to protect equipment from being contaminated? That was a tongue twister. And what do you think the correct response is? Everyone has this right. Great job, team. I see a lot of B's. So B is the correct response for this one. And yes, whenever you're using PPE, commonly also referred to as personal protective equipment, it's worn to minimize exposure to hazards that can cause serious workplace injuries and illnesses. These injuries and illnesses may result from contact with a bodily fluid, chemicals, and/or other workplace hazards. All right, so number 11. Which of the following is not a common sign of infection in patients? A, fever, B, swelling, C, decreased heart rate, or D, redness and warmth at the site of infection? Wesley Sniper, you have it. Great job. The correct response, everybody, is C. So the rationale, fever, swelling, redness, and warmth at the site of the infection are all typical, or site of, it's a site of infection, are all typical signs of infection. But decreased heart rate is not typically associated with infection. Instead, an increased heart rate, also referred to as tachycardia, is often observed as the body's response to infection. So with infection, the heart rate goes up and the temperature also increases. 12, a systemic sign of infection. That means that this infection is all over. A systemic sign of infection is A, swelling, B, redness, C, heat, or D, fever. Marcia, you have it correct. Yes, Darlene. All right, Kenya, everybody has this one correct. It is D is in dog. So fever. And the explanation is that the signs and symptoms of infection can be local or systemic. And systemic's another way for saying body wide or more diffuse. And some of the systemic signs of infection include a loss of appetite, rapid pulse. We just talked about that. Tachycardia, the heart rate goes up and the pulse goes up too. Fever, and if a lab has been ordered, usually you will see that the patient's white blood cell count is also elevated. 13, the nurse tells you Mrs. Kramer's pressure ulcer is not healing because it is covered with a biofilm. A biofilm is best described as A, an easily identifiable pathogen, B, colonies of bacteria with a very strong sticky outer coat, C, an airborne pathogen, or D, a protozoa. Yes, everybody. Yes, yes, yes. I'm doing my nursing dance, but I'm not going to cut on the camera because my hair's not done. So, the correct response for this one, everybody, is going to be B. So, a biofilm is a colony. It looks like a web of bacteria that has a strong, sticky outer coat. And it can be present on chronic wounds, and it can be difficult to identify and to treat. So, if you ever see something abnormal that you're not familiar with, doesn't look right, no one's addressed it, you want to get that nurse in the room. And as the nurse, I would be notifying the doctor so we can get a specialist in to see this patient. Number 14, which vital sign is typically elevated in response to an infection? You have to get this right. Is it A, blood pressure, B, respiratory rate, C, oxygen saturation, or D, temperature? I expect for everyone to get a 100 on question 14. And yes, 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 everyone, I see the correct answers coming through. For this one, it's not blood pressure. So, when someone has an infection, what you're normally going to see is an increase in their temperature. So, the rationale, fever indicated by an elevated body temperature, is a common response to an infection, while changes in blood pressure, respiratory rate, and oxygen can occur secondary to severe infections or complications such as sepsis. That's severe. They are not typically the primary vital sign affected by infection. Number 15, the nursing assistant is selecting the appropriate PPE attire to wear prior to delivering care to a patient who's been placed on contact precautions. Which of the following items should you wear? Is it A, gloves and gown, B, gloves, gown, and a face mask, C, gloves, gown, a face mask, and a face shield, or D, gloves, gowns, a HEPA mask, and a face shield? Lord, that's a lot. Your patients on contact precautions, what do you wear? And contact precautions is the simplest precaution. And I see so many correct answers. And Anna, Marcia, Christine, Hiroko. Yes, you all are correct. It is gown and gloves. So contact precautions require the use of gowns and gloves at the very minimum. Droplet precautions require the use of a medical mask in addition to the other options. Airborne transmission precautions at a minimum requires the use of that special mask, the N95 mask, also known as a particulate respirator. And so you're going to learn these when you go into your facilities. They're usually going to have a sign on the door, and it's going to tell you the type of isolation a patient's on, and it will tell you the minimum PPE requirements. So right now, we're going through it, but in the real world, there's going to be help and reminders. The signs will also tell you whether or not you can use hand sanitizer, which is also important. Number 16, which of the following is not a bodily fluid? A, tears, B, feces, C, saliva, D, emesis, which is another way of saying vomit, or E, none of the above. Which is not a bodily fluid? This one's tricky. Christine. Christine. You got it, young lady. Yes, it is E. None of the above. Holla. There we go. Great job, team. So, all of those were actually bodily fluids because you have to remember that liquid feces is called diarrhea. That would be a fluid. So, tears, feces, saliva, and emesis. And this picture shows you the other types of fluids that could honestly be contaminated. So, whenever you're dealing with bodily fluids, you want to make sure that, of course, you wash your hands but that you also use gloves. Number 17, which of the following symptoms is commonly associated with a respiratory infection? A, polyuria, B, hematuria, C, dyspnea, or D, jaundice? A respiratory infection. Oh, Anna, you're quick to the draw. Yes, Jesus is our guide. Yes, Chrissy. Yes, Anna. Yes, Brianna. Um, Go Tom. I'm not going to mispronounce your first name. Letitia. Great job, team. It is dyspnea. So, dyspnea or difficulty breathing is a common symptom of respiratory infections such as pneumonia or bronchitis. Polyuria and hematuria are symptoms associated with urinary tract infections, poly being much. So they're urinating a lot. Hema being blood, they have blood in their urine. So that's associated with UTIs. While jaundice is typically indicative of liver or gallbladder issues. And jaundice is the yellowing of the skin. All right, so, or also the whites of the eyes. 18. Which of the following is a common risk factor for urinary tract infections or UTIs in elderly patients? A, high fluid intake, B, regular voiding schedule, C, immobility, or D, low sodium diet? Which of those would cause someone to get a UTI? Hiroko, you got it. Yes, you're absolutely correct. So, yes, 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 I see the correct answer is coming through. The answer is C. Immobility can lead to urinary retention and incomplete bladder emptying, and that increases the risk of a UTI. High fluid intake and regular voiding schedules actually prevent UTIs. And meanwhile, low sodium diet is unrelated to UTI risk at all. So great job. Number 19, you have cleaned up a broken blood tube which was dropped in your patient's room while you were performing care. What do you do now? A, let the nurse know so the blood can be redrawn. B, let housekeeping know so that additional floor cleaning can be done. C, nothing further as you have followed procedure and policy in the cleanup. Or D, both A and B. Yes, everybody. Can't trick you all. It is D. So both A and B. So the type of spill needs to be attended to in many departments and has many ramifications, which your presence and actually can assure all covered. The nurse or phlebotomist will redraw the blood. Housekeeping needs to conduct additional floor cleaning to ensure there is no residual glass or blood. And so, yes, we work as a team unless your facility says otherwise. Usually the CNA is not cleaning up glass or blood. We need to have somebody with special cleaning agents come and do that. Number 20, which of the following symptoms is not associated with tuberculosis disease? A, night sweats, B, hemoptysis, C, weight gain, or D, fatigue and weakness. And if you don't remember from the previous slides, tuberculosis is a disease that infects the lungs. So when someone has lung disease, what do you expect? Tuberculosis, an infection. And Letitia, Jesus, Kristen, Anna, Chrissy, you all are correct. They are not going to gain any weight. So weight gain is not associated with tuberculosis because they are struggling to breathe. They're coughing all the time. They're more than likely going to lose weight. They are not going to gain weight. And then hemoptysis is actually the spitting up of blood. And yes, whenever the lungs are damaged, they keep coughing. There could be some blood tinged sputum that comes up. So that would be something normal for those who have tuberculosis. 21. Which of the following actions by a CNA can contribute to the prevention of catheter-associated infections? A, keeping the catheter tubing below the level of the bladder. B, encouraging the patient to increase their fluid intake. C, avoiding hand hygiene before and after catheter care. Or D, securing the catheter tubing with tape to prevent movement. Which of those prevent infections? All right, I agree with you all. I agree that it's A, but it's also B. So yes. Oh, let me go back and look at A. So yep, I am wrong with this one. I'm going to stand correctly. You all are correct, and I was wrong. Look at you being smarter than a nurse. So for CAUTI, recognizing the signs, I think this is the wrong slide. Let me go back. You all bear with me. I think I did something crazy here. All right, so I don't have the answer there, but you all are correct. It is A. So this is not the correct slide. All right, 22. Which of the following actions by a CNA can contribute to the prevention of, oh, there it is, the same one. So yeah, I was doing too much. And so for this one, we put B, encouraging the patient to increase their fluid intake. But I totally agree with you all. If you raise that bag above the level of the bladder, that is going to also increase the chances of that person getting an infection. So for this one, I stand corrected. I think it should be both A and B. All right, so next one, 23. Why is mouth care important? A, bad breath is unpleasant to be around. B, bad oral hygiene can lead to malnutrition. C, infected teeth and gums can spread infection to other parts of the body and the blood, causing infections and sepsis. Or D, all of the above. Why is mouth care important? Yes, yes, yes. I'm seeing all the correct answers. And be prepared for some not so nice looking teeth. All right. So, when your patient has poor oral hygiene, it infects their or it can impact their entire body. So, in addition to having halitosis or bad breath, they can also have infections that go into the gums. The infection can enter the bloodstream and it can enter their lungs. So, whenever you have a patient, if they're unable to provide their own mouth care, we need for you to do it at least once per shift or more often. And if your patient is maybe in a condition where their teeth are like this, we may not be able to brush their teeth. So that's when you'll use an oral swab or a tooth et. You can put some mouthwash on it, and you can go around those teeth and those gums and also clean their tongue with mouthwash instead of brushing it the traditional way. Because if we brush this person's teeth, their gums may start bleeding. 24. Is there a correct order to follow when putting on PPE? A, yes. B, no. C, yes, but only when the nurse is watching. What do you think the best response is? Yes, yes, yes. There is a correct order. And I have an image here from the CDC. And so you're supposed to put the gown on first, followed by the mask if one is required, then the goggles or the face shield, and the last thing you put on will be the gloves. And so if you have any questions about how to put on PPE or how to take it off, a quick Google search, CDC PPE. If you search for that, you'll find both of the infographics and you'll know how to put on and how to take off your personal protective equipment. Number 25. What is the recommended frequency for perineal care in patients with indwelling urinary catheters to prevent infections? A, once a week, B, every 12 hours, C, every 24 hours, or D, only when the patients complain of discomfort. How often do you provide care to their genitals if you're trying to prevent a catheter associated infection? Think of it that way. And yes, Anna, yes, Brianna, yes, Letitia, this is every 12 hours, but I want you to think at least once per shift. So if your shift is 8 hours, you make sure you provide care down there and clean that catheter. But performing perineal care every 12 hours helps to maintain cleanliness and reduces the risk of CAUTIs or catheter associated urinary tract infections. And so, you all, I am so proud of you. You did an amazing job. And I'm going to come back on here later tonight and we're going to go through one of my test banks. And so if you missed tonight's broadcast, you can always rewatch it. And of course, this is Nurse Eunice. I enjoy spending time with you all. I wish you all much success with your future exams. And I'll see you all in the next video. Bye.